Hello, everyone. Good afternoon. Good afternoon on the East Coast. I know some of you are still not into the afternoon hours yet on the West Coast. We are about to start. I'm seeing people popping in here, but we are about to start the closing session, session 9 of Leadership Training 2021. And I'm telling you what, we are going to close it out with some really nice sessions for you. We have three different sessions today, 2 by the lovely Jessica Daly and 1 chair yoga for anyone, any level. It's just a good stretch. You can do it with your kids by Barbie Nunnally, who's going to be fabulous. And I'm just looking at people getting in. I'm going to move to the next slide and give a few items that you need to know. So we're in a webinar, and that means you guys are muted, and so you don't have a choice to unmute yourself really. But when we get to at any point during Jessica's presentation, there is the chat box for Q&A, and there's also Q&A for Q&A. So if you have questions, you can type them into the Q&A box, and we will ask them of her at the right times. Or if you post into the chat box, that is fine too. If you can't hear, as Andrea says, hopefully you can read the slide, and you just need to check the sound on your personal computer and make sure your speakers are on, everything's coming out okay. That is typically the issue. That's true. Please do use the chat box or the Q&A. And so because it's a webinar, you see something called Q&A in your control panel, and Q&A is a great place to type in questions. It lets us see that it's a question more easily versus a comment, and that's very helpful when we're trying to ask the speaker questions. And again, questions will be answered as we can. We do encourage questions and discussion. We want this to be participative and interactive. So I am going to turn it over to Jessica Daly and let her tell you a little bit about herself and the things she is going to talk about today. Jessica?
Well, thank you guys so much. I'm so excited to be with you, and very happy that it is the ending out of your sessions. And this is just really a time for you to focus on yourself. And so I hope that that's what we do during this time. I'm going to give you some resources that you can use. So hopefully this is going to be a really encouraging, hopeful time together. So in this first session, we're going to actually talk about reflections of the heart during COVID-19. And we're going to talk about a couple different levels of things. The first is just really the fear of the unknown, which is part of our journey through any type of cardiac disease or situation. And I'm going to tell you a little bit about how that hit home for me. We're going to talk about taking precautions, because even though things have gotten much better in our world, in our country, and even within maybe your state, we still need to be careful, especially as heart patients or caregivers to heart patients. And then a little info on vaccination. This is definitely a personal choice. We're going to discuss that today, but just talk about the risks and benefits associated with that. And then what does our new normal look like? Pretty much almost a year and a couple months later, what does life look like? Okay, so a little bit about what I do. How am I here? Why am I speaking to you on these topics? So I live in Orlando, Florida, and I'm what's called a Consumer Health Librarian. And really what that means is I am a medical research librarian, but I only work with patients and their families. And I also work all throughout the community. And my goal is very simple. I want you to have the best health information that's out there, so that it empowers you as a patient or as a caregiver. And so when we know more, we feel better. And so that's really my job. I connect you with resources in your native language, make sure that you have resources that you can read, that you can watch or listen to, whatever best fits your learning style. So that's what I get to do all day, every day. And then also do what I'm doing with you today, which is health education. But I'm really bringing you resources. I'm showing you where to look online to find these resources for yourself. So what is health literacy? Okay, let's begin with that. I want all patients and all caregivers, I want everyone really to be health literate. It has nothing to do with our education, our reading level, our comprehension, nothing at all. What it means is how well we understand our health, or how well we understand the health of someone we care for. So where are you getting these resources? Are you getting them from a friend or from Google, which I want you to be really cautious of, or are you getting them from reputable sources that are created for patients? Are you getting them from someone like me? And then can you read what we give you? Can you read what's given out? And then here's the real kicker. Can you understand what you read? I always tell this story because I was in past lives, I was a middle school teacher. And whenever I would do what was called fluency tests, this would mean I would sit down with a student, I would give them a paragraph, and I would listen to them read. And every time they missed a word, I would make a little mark. Well, here's what I started noticing. A lot of my children were 100% fluent. They could read and pronounce every single word. But at the end of reading the paragraph, when I would ask them a comprehension question, maybe who was this paragraph about? Where were they going? The students couldn't answer me. So this is what happens to patients. And you understand that as a patient or as a caregiver, you understand that often we're handed information that we can't really understand. We can read all the words, but we can't understand exactly what they're saying. So I want you to be able to do that. And then once you get reputable information, you can read it, you understand it. Then comes the key element of health literacy. You can use that information to make the best decisions possible about your personal health. And that's what I want. I want you to be empowered so that you're an active participant in your healthcare team. All right. Figure this out. Sorry, I'm slow on that. So I always go to reputable sources. And one of those that I go to quite often is actually the CDC, Centers for Disease Control. And this is what they have to say about patients with low health literacy. So that would mean a very low understanding of their health. Look at this. They go to the emergency room more often. They have more hospital stays. They're less likely to follow their treatment plan, not because they're defiant toward their instructions. They don't understand why to do them, what the risks are, what the benefits are. And then in the end, these patients have higher mortality rates. So I want to slash all this. I want patients to understand so that they're not going to the ER as much. They're not in the hospital. They know how to follow their plan and they're living healthy lives. Okay, so let's dive into fear of the unknown. So if I can take you back to not this past March 2021, but March of 2020. I know for myself, for our family, I can just speak to what this looked like for us. And so I have to tell you a little bit about one of the very important members of our family, and that is my husband, Brian, of 21 years plus. And he is a congestive cardiomyopathy patient. So he has unexplained heart failure. And we've been on this journey now for 15 years. May 5th, which is Cinco de Mayo, that is his diagnosis day. And so we celebrate that every year. We call it the Heartiversary in our house. And we either go out for a fancy meal or we go out somewhere overnight or we, do something special. We celebrate because every year we have him for one more year than we were supposed to. So with that said, I have a heart patient in my home. I also have an 18-year-old daughter, and I have myself. And so when March of 2020 came around, I remember it very vividly. The first week of March, we actually had friends come in with their college-age kids for their spring break. I remember we went to Disney. We did all kinds of fun things. And I remember hearing about COVID. I remember I'd seen it on the news some. I remember the days we went to Disney, I was the sanitizer, because I've always done that anyway because of my husband. And so I remember those things, but still no clue as to what was going to happen. And I very well remember the very next week on a Monday, we went in for an emergency meeting for our learning department at our hospital system. They sat us all down. It was very morbid. It was very serious. No one was laughing. No one was joking. And everybody was just on edge. And we were told that we were going home and that we were going to work from home. And we had to figure out our job, how to do it from home. And so this was a really scary meeting. And so I remember leaving that meeting and running straight to the grocery store, just trying to get things that we would need. And this was even before the whole toilet paper thing. And so I just remember this fear that overtook me, as if I had to put my family in a bubble and protect them, especially my Brian. And so when all of this started happening last year, it was just a time of fear from the unknown. You know, I often tell patients, when we know a diagnosis or we know what's going on, it can be really bad, but when we got a plan or we know what to expect, it erases a lot of that fear. So it was just really a time of unknown. Okay, let's see. Okay, here we go. Well, let's see. There we go. All right, so I love these two pictures of what March 2020 looked like. I wanted to shrink wrap our house. I wanted to do that. If I could have, I would have. A lot of people were very afraid, and they were very afraid if they had a member of their family that already had a health you know, if they already had a disease or they already had some type of diagnosis that they were already facing that put them at risk. So our high risk patients, people that were, you know, already diagnosed with a disease or maybe had a low immune system, they were very much at risk, and we were very scared. And again, the news media, I will blame them. That's okay. I believe that they, instead of calming people and always giving good information, a lot of times it just grew the hysteria, it grew the fear. You know, a lot of the numbers I can tell you, because I'm in the medical field, were very, you know, misused, misrepresented on the news. It was a horrible, horrible situation, yes. But do I believe that the news media blew this up to really put everyone in a state of fear? Absolutely, I do. And I was one of their victims, so I can say that. So I love this picture of the guy in the suit with the mask and the Lysol. I felt that way. I was very afraid for anyone to come to our home, visit us, even drop things off. I had our groceries delivered. Yes, I was one of the ones that wiped down every grocery item with sanitation wipes, worried that we were going to get it that way. It was just very unknown. And then what really brought it all to, you know, I guess ahead was when the world actually closed down. We were all homebound. We were asked not to go out. Stores closed, restaurants closed. You know, we live here in Central Florida. When Disney World closed, that got our attention, let me tell you. So, you know, this was what we were experiencing. So what really happened? What is still, I know a friend of mine, her roommate right now has COVID-19. And so I'm helping her with precautions and what to do, you know, during this time. But it is an infectious disease caused by a coronavirus. And most people affected with this will have mild to moderate symptoms. It is a respiratory disease. It attacks, or virus, it attacks your respiratory system. And also it was very, you know, we knew that we needed to be very careful with older people, anyone with underlying medical problems like cardiovascular disease and diabetes, chronic respiratory, and even cancer, that they were at a much higher risk. Well, what were the symptoms? What are the symptoms? Because COVID hasn't gone away. I want to reiterate that to everyone, not to make you fearful, to make you empowered with information. But as this went on, we saw that it lasted about 2 to 14 days after exposure. People had lots of different symptoms. These are just a few of them. A lot of people, I knew a lot of people that just thought they had a sinus infection and then got tested and knew it was coronavirus. But then I also knew of people, thankfully none close with our family, but people that we knew of that were hospitalized, and a few people that because of underlying conditions passed away while having coronavirus. So this was a very real, still very real thing. We've just come so far from where we were. So what do we know? That's what we got to focus on. We know that COVID-19 vaccines are effective at representing or preventing, I'm gonna get this in a second, COVID-19 disease, especially severe illness and death. So here's the whole thing. Just like the flu vaccine, you could get a vaccine and still get the virus or the illness. But what we've seen in studies is that even if you do, it's not going to be as severe. It's not going to be, risking your life. It's not going to be a life or death situation. That's what I want to say. We also know that vaccines reduce the risk of people spreading COVID-19. But here's what we're still learning. This is still ongoing. How effective the vaccines are. We still don't know. Do the vaccines last a year? How long should we go? When do we need another vaccine? Early data shows that the vaccines may work against some variants, not be effective against others. It's, there's not a foolproof vaccine. Also, how well the vaccine protects people with weakened immune systems. So maybe someone that doesn't have an underlying health concern, it may be a little more protective for you. Let's say that if your immune system is low. Also, if you take certain types of immunosuppressive medications. And then how long, we just talked about, will the vaccine protect people? But as we know more, we're learning all the time, every day, and knowledge is power. So taking precautions, I want all of you to take precautions, want you to continue to take precautions. So what can we continue to do? Well, the first thing is I want you to really think about what situations you put yourself in. Also think about what your comfort level is. If it gives you great anxiety to go out in public, well, maybe you need to go when it's less crowded times. So here, for instance, is something my family had to do with me. And I can speak to this because they said I was one of those extreme people. I had allowed fear to just completely overrun my mind, my being. I just lived in fear at all times. The way I described it to people, and I know I'm going to sound really crazy to a lot of you, I felt like I was having to protect someone from killing my family. Like that's the state of mind I was in at all times. And so, that was not good. But here's what happened. Last year, when we could start getting out, with distancing, with masks, taking precautions, I was still at first terrified to do that. So we would do things like we would go to Walmart at 7 in the morning. Okay, because there's hardly anyone there. That made me feel better. So even today, if that makes you feel better, think of ways that you can lower that anxiety, because the anxiety and the stress began to affect not only my mind, my personality, but it began to affect my health. And let me just say that my family, truly, my daughter and my husband one night did really somewhat of an intervention with me. And they sat down and they said, we can't do this anymore. You've got to get a handle on this. We're here to help you. We love you, but we can't continue to live in the bubble. We want to start getting out. We want you to stop getting upset, because here's what would happen. Let's say we would see someone out without a mask on. I would become furious, like they were trying to kill us. No, that you can't have that mindset. You can't have all that anger inside. It was eating me away. And so that was the day I realized, okay, I've got to be careful, but I've got to live, and I've got to let my husband and my daughter live. And so that's just me. I like to share that. I love to be transparent with you, but here's things you can continue to do. You can continue social distancing. You don't have to be right beside everyone. You can stay home when you feel like it's a better situation. Wash your hands frequently with soap, at least 20 seconds. And I know you've heard this before, but you can sing happy birthday. That is kind of the same length, but don't touch surfaces out in public. Try to do that as least as possible. Wear a mask or a cloth face covering. Even when, there's social distancing, you can continue to wear face masks. Here in Central Florida, it is not mandated most places. Some businesses and restaurants are still asking for you to wear them, and I'm very respectful of that. Because on the flip of that, I went through a very anxious time when I stopped wearing a mask because I felt very exposed and like I was doing something dangerous. So you've got to deal with all those different steps. But wear one if it makes you feel comfortable. I see tons of people still out with masks. No one knows everybody's situation. Cover coughs and sneezes. While we weren't pushing this, I guess we did, but we didn't think about it as much. Now I'm terrified to sneeze or cough out in public. If you don't have a tissue, you can always cough or sneeze into your elbow. That's always something you can do. And just try not to touch your face. Do you know we touch our face a lot? We touch our face a lot. So just being mindful of not touching our face is really going to help. So who's at greater risk? Well, we're a group, cardiac patients and caregivers. We are a group that is at risk. I don't say that to make you fearful. I say that's information. It's what you need to know. But what we also know is that older adults and people with underlying medical conditions are more at risk, not for getting COVID-19, but they're at higher risk of developing serious complications, maybe being hospitalized. So these include all of these people you see here. Some people don't even think about some of these areas. They haven't even been mentioned on the news, like people with kidney disease, Down syndrome. When we talk about obesity, if you have a body mass index higher than 30, you're at a risk. You're a risk group. If you're pregnant, we didn't hear that a lot. Sickle cell disease. If you're a smoker, I would hope you would know that, but I'm just saying that. And then if you have type 2 diabetes. So some of these are mentioned a lot on the news and in the media, some not so much. Is there more I can do to protect myself? Absolutely. If you smoke or vape, I want you to look into stopping today. There are tons of free resources that I can hook you up with. You can email me after this is over. Here in Central Florida, we have what's called smoking cessation classes. They are free. They're offered at many of our hospital locations, but also they've been virtual online. And it's just, people that are experts in helping you stop this addictive behavior, because I get it may not even be something you choose to do for fun anymore. It can be something that you are addicted to. And let me just be the first to tell you, I've researched it a ton. Vaping is worse than regular cigarette smoking. And if you don't know that, also email me. I have a webinar that I did on vaping that's very eye-opening, and I can send that to you for yourself or to share with loved ones that maybe are vaping. And then cleaning regularly. Here's what I hope doesn't go away, and I'm afraid it will, because I've already seen little things. I love that during COVID-19, people cared about cleanliness. When you went to stores, when you went to restaurants, when you went to anywhere out in public, you saw people cleaning all the time. That's wonderful. We need to be doing that. That really will stop a lot of disease that travels from touch, that gets on our hands and then into our bodies. So, one of the things that I noticed the other day, it did make me a little sad. It's probably different everywhere everybody lives, but all of our grocery stores, whether it worked or not, I don't know what they were using to clean, but they would clean all the carts. And I noticed this past week, Nobody's cleaning the carts anymore. But guess what? It's up to me. So I have my sanitizer. When I walk in the store, I fill my hand up. I do my hands. I do the cart handle. At least that's doing something. And a lot of places still have wipes for your cart. I saw today Target was still doing it. Yay, Target. I'm not telling you go to Target, but they were doing it. They were still, cleaning those carts, and they had sanitation stations for you as well. So just think about those things. But in our homes, we sometimes have this illusion that our house is clean. And I often think, if the health department came in my house, what score would I get? I don't know. I would think, oh, an A, but I don't know. There's areas that maybe I don't clean as often as I should. And I just assume that it's clean because it's my family. Well, guess what? My family's dirty. All our families are. We are. And I have pets running around my home too. So we want to clean high touch surfaces as much as possible. Focus on things that people touch a lot, like the handles on your appliances in the kitchen, handles and doorknobs around bathrooms, light switches, we show it here. So clean these areas as often as you can think of it. Don't become obsessive about it, but just a couple times a day would be great. And then monitor your health. That's what you can do. All of us, whether we're a cardiac patient, cardiac caregiver, whatever our health is, we can monitor our health every day. We know our bodies, if we're honest, and we know if something's not right. So we want to make sure that if we think we could have COVID-19, that we are tested, that we do get medical assistance. We let our doctor know. Great example. Good friend of mine lives here in Orlando. She has a roommate. We were supposed to get together on Sunday, our family and her. She called us Saturday night. She said, don't come over. We can't get together. My roommate is sick. She's had a COVID test. She won't know till tomorrow. We're pretty sure she has it. So I went over everything for her to do to protect herself. Found out this morning that she does in fact have COVID. So she's being protective of us. And that's so important for us to do that too. Okay, we talked about washing our hands. If you can't wash your hands, that is the best way to get rid of germs and bacteria and virus that are on our hands. But you can, make sure that you use sanitizer anytime that you can't have your hands actually washed with soap and water. But here's when I want you to wash your hands: before you eat or prepare food, before you touch your face, after you leave the restroom. I do have to tell people that often. After leaving a public place, when we get in our car, we get the sanitizer out. We're, coating everybody. After blowing your nose, coughing, or sneezing, after handling your mask, definitely after changing a diaper, caring for someone who's sick, or touching your animals and pets. And I have to remind myself of that because I love my pets. They're part of my family. But when I touch them, I wash my hands before I get myself a snack or I do something in the kitchen. Okay, so laundry. You want to use the warmest appropriate water setting if you can. Especially if there's someone sick in your home and you're washing their laundry, you might want to have different laundry baskets. Have a dirty basket and a clean basket. Often we throw the same clean ones in the basket we dumped out that was dirty. And wash your hands after you handle dirty laundry. Electronics, there are wipables, there are covers, there's all kinds of things that you can put on them, but we touch those all day long. Here's my phone. I touch it all day long and I lay it down or it might fall. So you want to make sure that that's clean too. All right, and reduce contamination of surfaces. Take steps in your home to limit contamination. You can ask people questions. Do you know that? It's not rude. If they get offended, oh, well, this is your health you're talking about. So you can ask visitors who aren't vaccinated, fully vaccinated, to wear a mask. That's fine. I've had a lot of people still ask me when they come to my home, Jessica, would you like me to put a mask on? I'm fine with that. I've not had anyone be offended or upset about that. And guess what? If they were, I would tell them to stay home because my husband and my family's health is more important than someone being offended. And then follow guidance for people who are fully vaccinated. Isolate people that you think are sick with COVID-19 or sick with anything. We've focused so much on COVID-19. I want us to know that the flu's still out there. Stomach bugs, viruses, colds, strep, all of it's still there. And we don't want any of that. And so we want to be careful, and then invite everyone in your home to wash their hands often, especially if they come in from outside. Okay, so I wanted to give you this resource. If you have questions about coronavirus or COVID-19, this is a free live chat or phone number that you can go to. I actually got this off of the American Heart Association. Most of everything I've shared with you today came from there, which is a great resource if you don't already use it, and I'm sure you do. But this is a COVID chat line, and this is also a phone line that you can call and ask any question. It's completely anonymous. You don't have to tell them anything about yourself. They are just there to answer any questions, and information changes all the time. I even saw this and went, I need to call that like on a weekly basis and just be up to date what to tell patients. All right, so really fast, vaccination facts. So far, everything that we've seen in research, for the majority of people, COVID-19 vaccines have been proven to be safe and effective. Now, everyone reacts differently from them. First shot, we were good to go. Second shot, my husband and I both, I was 24 hours, he was 36 hours, felt like we had the flu. Just depends on the person. But you can learn about different vaccines. Again, you can go to vaccines.gov. That's a great resource. And then also you can call to find out where COVID-19 vaccine locations are near you. So this is great information. As far as which do I prefer, I don't really have a preference. Just depends on what's available. I know I had Moderna, my husband had Pfizer. We pretty much reacted the very same way. But there are some side effects. So I do want you to understand that. But here's what I tell people. For me, this is me. For me and my husband, we felt like the benefits outweighed the risk. So we did get vaccinated, but that is a personal choice and decision. I'm very adamant about that. That is not something you should be pressured into or guilted into. It is up to you to have that. So long-term side effects, people ask me all the time, and guess what? I don't know yet, because the people that I know of that's had it the longest, December, January was a year. And so we really don't know about long-term effects at this point. So our new normal, what you can start to do, you can resume your regular activities prior to the pandemic. You can resume activities in some situations without wearing a mask or staying 6 feet apart, unless it's asked by the place you go into. I don't understand. Here's an example. My daughter works in a clothing store. They still wear masks as employees. And up until a couple of weeks ago, their patrons, their customers had to wear masks. She said people would come in, they had it plastered on the door that if you want to shop with us, you have to wear a mask. They would come in and curse at the people. They would fuss. They would get loud. They would shout about having their vaccine. That's ridiculous. If a store or an establishment asks you to put a mask on, we should do that very graciously, very respectfully. What if someone came in your home and you said, we're at risk, we need you to wear a mask, and they started cursing you? Or no. So we want to be respectful of that wherever we go. If you travel in the US, you don't need to get tested before you travel or self-quarantine, but make sure that you check into any international travel you may do. And there's different websites, different places you can go for that. If you need more information, you can let me know. But if you've been around someone with COVID-19, you do not need to stay away from others if you have been vaccinated. But you might want to be careful, and you might want to take some precautions there as well. So I've avoided getting checkups and, not had blood work, not been checking my blood pressure, all these things. So I want you to know that you can go back to the doctor. It is safe. They are very cautious at the doctor's office. We've been several times, but also there are virtual appointments. The downside to a virtual appointment at this point for a heart patient is they can't really listen to you. They can't do an EKG. They can't do blood work at home. They can't listen to your heart from home. So you want to be, aware of that. I feel like you're safe to go back. So where did I get the info for this section of our session? I got it from 3 places, and all of these places are open, free to you as a patient. The American Heart Association, and I'm going to say one of the best patient-centered, patient-written websites out there on any disease. So that is awesome. Then I did the CDC, Centers for Disease Control, and then a really awesome resource I want you to make sure you hear about this and use this. It's called medlineplus.gov. This is a trusted medical search engine. It is created for patients and it's put out by the U.S. National Library of Medicine. So this is where I got this info today. And then finishing up, I'll show this to you at the end of our other session as well, but this is my email. You can email me anytime. My services are free of charge. Doesn't matter where you live, as long as you have email. You can email me at jessica.daly@orlandohealth.com. And the cool thing about my position as well is it's funded through a local foundation, so I can help patients from anywhere. You don't have to be a patient of Orlando Health for me to help you. So you can email me anytime. You can also visit our website. It's here, orlandohealth.com/library. And you can check out the resources and the things that I have there as well.